todos. Thank you for coming, and I'm really happy and excited to be here with Yann and to present a little bit more about what is BIOME and how Novartis is implicated in this whole digital transformation. As you may probably know, at Novartis, we want to reimagine medicine to improve and extend people's lives, but also we want to push science beyond the limits. No? We are currently living a double revolution. On one side, you have the biomedical revolution, starting years ago with the mapping of the human genome. And on the other side, occurring at the same time, you have the technological revolution with AI, with blockchain, with all the things that we are seeing right now in this Congress. And both revolutions together are currently impacting and disrupting the healthcare sector. And this double revolution is allowing us to develop at Novartis really highly disruptive technological platforms for diagnostics, but also for treatments. And in our sectors, in oncology, for example, there are lots of disruptive technologies, lots of breakthroughs that are coming in the following years. In treatment, we are working with 4 platforms, and we are trying to combine these platforms to reach the best treatment for each patient. We are working with immunotherapy, targeted therapy, radioligands, and cell and gene therapy. And in the diagnostic part, we are working also in biomolecular diagnostic and biomarkers. And this old system, we are, with Novartis, in Novartis, we are convinced that combining innovation and collaboration, it's essential to really make a huge impact, a disruptive impact in terms of seeking solutions for the patients. And therefore, we are committed to develop, to launch initiatives, to co-create solutions beyond that go beyond the development of the therapies, not only the therapies, but go beyond that. We believe that to make innovation possible, we need to collaborate. Everyone, I think, is okay with that. And we need to collaborate. We must work in a true ecosystem and not an ecosystem with every partner's working alone, but a trusted based ecosystem, working with startups, working with the whole digital ecosystem. And when I'm talking about the whole digital ecosystem or the whole partners, I'm talking about academics, I'm talking about hospitals, I'm talking about government, I'm talking about startups, other industry, everyone that can really make an impact on people's lives. In that sense, I wanted to present the BIOME. It started 3 years ago, more or less, and it's a global network of digital and innovation centers all over the world. And in Spain, today we are launching officially the BIOME in Spain. And it has been created to strengthen the connection, the interaction between Novartis and the stakeholders. And again, all stakeholders of the digital environment. And the goal of this BIOME is to accelerate and scale these possible innovation, but also the connection between the stakeholders and allow our team to create, to develop, and to drive collaboration, focus on co-creation. The most important thing is co-creation. Co-creation with, as I said, the partners, technological partners, but also the hospital, with the same focus, patient centricity. And we are working a lot with physicians, with patients, with caregivers to have the voice of the patients. And this is why I'm really happy to have Yann, Dr. Yann Izarzugaza from the Foundation Jiménez Díaz in Madrid, that is medical oncologist, specialized in breast cancer. And I'm really happy to share the stage with him because he's also the voice of the patients. And I'm happy to invite him to come here and to share with us some experience in the environment of the hospital. Thank you.
Well, thank you, Marion. Can you hear me all right? Okay, thanks. Yes, actually, I'm Yann Izarzugaza. I'm a medical oncologist at the Fundación Jiménez Díaz in Madrid. and thank you for the kind invitation to give my point of view about what we are doing and what we are trying to do for innovation and to take better care of our patients. What we used to do before as physicians was really an old way to work. We used to take all the decisions for the patient. We were almost like a father figure who would take all the decisions that matter to the patient almost without consulting them. And this is changing a lot lately, because we know that it's very important that the decision has to be made by the right person, and that is obviously the patient. To achieve that, we need to give accurate and good information to all our patients and just advise them on what we think is the best way to practice. In our hospital, we have been developing a lot of different strategies to try to help the patient in different ways. One of them is to give them access to all their medical records. They have an app in their mobile phone in which they can have access to all their medical records. They can change their appointments if they want to, so that they don't have to come to the hospital to do this kind of paperwork. And also, we can launch them forms to fill in so that they don't have to come to a hospital consultation, to a hospital visit that has no value for them. We ask them the questions that we need to know, they fill in the forms, and the physician can take a look at them and take the decisions that have to be made. In the way we treat patients in oncology, we have changed a lot also. Some years ago, in 2018, what we used to do is make an order of a lab, a blood extraction, and after that, the patient would have to wait until the lab would process his blood samples in the waiting room for 2 or 3 hours. Even some patients came the day before so that they wouldn't have to wait the same day. After that, we'd see them in our office. We would take a decision about how to treat them. They would have to go again to another waiting room, and they then go to the day hospital to actually get their chemotherapy or whatever treatment they would have. Since 2019, we have changed our way to work so that the patient journey is shortened. They don't have to come several times, first to a nurse for the blood extraction, then to the waiting room, then to the medical's office, then another time to the waiting room, and then to the day hospital for the treatment. What we do is that we give an appointment directly to the hospital, to the day hospital, to the patients. In the same site, the nurse asks them a series of questions that we have standardized, 10 questions about the matters that we care about, that would change our treatments if they answer it in a different way. In the same time, the nurse takes the blood sample, and we have within the day hospital a point-of-care system, which is a lab that gives us the results in just a few minutes. So in the lapse of 20 minutes, we have everything done, and the patient can receive his treatment. So we have shortened the time that the patient usually stayed at the hospital in a chemotherapeutic day, which was before 2019 of about 10 hours, to only 2 hours, most of them receiving the drug. So what we intend to do is go on further and try to really give value to the patients about what they really want. Nobody wants to be waiting for hours that the physician has the results of a laboratory. Nobody wants to wait then for another patient to go before them to my office, and so on. So we need to give really value about what we are doing to the patient. In the follow-up, we are also changing everything. In the follow-up, before what we do is we give consultations to the patient every 6 or every 3 or every 6 months. They would come to our office and we would see with them the results about their CT scan or their blood samples or the pathologist results. Now we are trying to change that also. Once we give the order of a CT scan to be made, for example, the patient does the test, but he doesn't come back to my office one day just to give them the results. We interpret these results, and I issue a report about what he has to do if everything is okay. Most of our chronic patients have good results, and for them to come just to be given an advice of everything is fine, we're just going to do the same thing, has no value either for them. So what we are trying to do is really make them come when we need them to come, when we have to give another advice, on when we have to change treatment, or when we have something important to say. But just to keep on going, we don't need the patients to keep on coming. So that's the way that we are trying to change this father figure that would take all the decisions, make the patient wait. The patient journey would very harsh about all these appointments. And now with the digitalization and with your help also, we are trying to improve all this journey for the patient and to give them a better experience, because medicine is not only about new drugs that will improve the results. It's also about quality of life, about what the patient feel and what we are giving them, what we are making them go through. It is important that the patient in his illness feels treated all right. And in that aspect, we are trying to make a big effort, not only, as I said, in drug treatments, but also in his travel. And my last point is what we're trying to implement now with web dialogues with the nurses, but also we are launching to patients in their apps patient-reported outcomes measures, PROMs, and also patients-reported experiences measures, PREMs, so that they can fill in and we can collect all these results, analyze them, and see in what point we are failing them and what point we need to improve so that they feel a better experience in their whole journey. Thank you for your attention, and I give back the speak to Julien.
Thank you. Thank you very much, Yann. It was very, well, the whole purpose of this event is to bring some physicians on stage to explain us the real life. So thank you very much, because I think it's very important for all the technologies we have here to understand really how we work and where we can improve. And the continuous improvement you finished on with the PREMs and the PROMs is very, very interesting. So I'm telling to the audience we will take a few questions in 30 seconds, so prepare your question, and some people in the room can pass you the microphone. 1 second. First, I will ask you, Marion and Yann, you are preparing a new innovation program on cancer, on oncology. Can you tell us more a bit about this program, please?
Yeah, just before answering, I wanted to thank Yann, and also it's just a part of what he is doing. There is chatbot, it's amazing how an hospital can be a source of inspiration for everyone, because they are really close to the patient. So this is also why he's here today, and why I will explain a little bit. We are launching the second edition of the Novartis Cancer Startup Program. It's a health tech startup competition focused on cancer patients. This is the second edition, but this year, in line with what I've explained before, we want to have a more collaborative way of looking for startups and evaluating startups. So we will count of partners from the ecosystems. We are counting with Barcelona Health Hub, for example, Collider, but also WIRA, and also a school, economical school, ESARE. But also we are counting on the voice of the patients, not directly the patients, but the physicians. So we will count on some oncologists, hematologists, such as Yann, to really give us the vision of the patients in the evaluations, and because the idea is not the quantity, but the quality, and really to reach the best solution that fits a real unmet needs for the patients. So okay. This is we are looking for scalable solutions, clearly. It's not about one single solution, but the scalable solutions. We are not looking for solutions that are really at the beginning of the development, but solutions that are with MVP tested in healthcare or with a growth opportunity, and really open to that, to find the best solution for the patients.
Perfect. So I understand the clinical teams are involved in this program, and which is great to have that.
Yeah, exactly.
Yeah, Yann, you wanted to react? What is the challenge for medical team to participate in such programs, or the motivation?
Well, we are eager to participate in this kind of programs because we see that the future is going that way, obviously. As I said, we have to implement global solutions for patients. And indeed, we are trying in different aspects to improve. The chatbot, as Marion said, is another of what we're implementing, so that the patient can have access directly to the most frequent questions and answers that they have, instead of looking for their physician or trying to take an appointment to make just a simple question. When they are at home, they can, with their mobile phone, ask their question, and with a chatbot, we have reviewed the most frequent questions, and we can direct our patient in the best way so that they don't need to go to the hospital to have a solution to their problem. Well, if the dialogue turns out that the patient needs to come to the hospital, obviously, we will direct them to the hospital. And if it is so, the physician on duty that day would have a notice on his duty phone that patient is coming because of that problem. For example, he has fever more than 38 grades, with paracetamol it didn't go well, and he was on chemotherapy with a kind of chemotherapy that can threaten his life, so that the advice would be from the chatbot to go to the emergency room, and the physician on duty would have a notice that this patient is coming.
Thank you. Do we have questions in the room? Don't be shy. Yeah, in the center, please. I don't know who has the microphone. Please, microphone. A bit quicker, please.
Yeah.
Hello. Yeah. Thanks.
Hi.
Thanks for your talk. I just wanted to ask about the challenge of integration, within these systems. So now you're focusing, for example, in a system for oncology, which I guess also is in a specific hospital. This could be also used in other hospitals, and also it could be in cooperation with other kind of treatments, for rehabilitation or stroke. So how do you see these challenges of keeping a current digital health environment for all these tools that are coming?
Yeah, perhaps I can start, and then Yann from the hospital. Clearly, it's a great challenge because on one side you can have a scalable solutions, but that are not integrated in the hospitals, and on the other side, an individual solution that are possibly integrated in the hospital. So you need to find a way to have both. We need to work with different hospitals. There is different way, the IT systems are different in all hospitals in Spain, so we need to find solutions, but we see that the integration is a key part. So we will not go to a scalable solution that is really great and fantastic, but if it's not integrated, if it cannot be integrated in the hospital, it doesn't mean any sense for the hospital. So this is really a key part. So is having the way of possible scalability of the solutions, but possible integration in the hospital. So we are working on that, but it's a clear challenge for everyone.
Thank you.
Yes, every disease has his specificity, but I think that there is a great common nexus about illness or about what we see in hospitals. And as a matter of fact, this way of working in my hospital started in the traumatology sector, where the patients were directed via digitalization and standardization to all the appointments from the very beginning, what they had to do, and they were also able to fill in forms about what they agreed with and what they didn't agree with. So in every area there are specificities, but I think there's a common nexus in which we can work and then go on to the detail.
Thank you very much. Do we have another quick question? Because we are running out of time. Yeah, Mr. in the middle, please. Thank you.
My question is for Dr. Yann. You talk at the end of your speech about patient-reported experience and patient-reported outcomes. So, do you have any results about it, or is just the goal inside your project?
We are just starting. As a matter of fact, in oncology, we are planning to do it with other hospitals at the same time, and we are right now. I have an appointment next week to discuss about what PREMs and what PROMs, because PREMs, there are not a lot of knowledge about them, but they are not just as standardized as our PROMs. We want to maybe use ICHOM as a standard set, but we are just beginning in oncology. But in hematology, they are already using it, and we have about, in 1 year, in the first year, responses about 30% of patients. So it's a good rate for our first year about feedback from patients.
Thank you very much. So we are running out of time of this session. Perhaps a last word, Marion, what do you want to say to these innovators and startups we have in the room?
Yeah, thank you for listening us, and thank you, Julien, for the invitation. Thank you, Yann, for coming from Madrid to speak today. And I think there is, here, if there is a startup that wants to impact patients with cancer in the whole life of the patients. We are talking about activation of the patients. We are talking about diagnostics, treatments, monitoring. We are looking for solutions that are that can have an impact of the emotional management, of the activation, the awareness of the patients, but also all the continuous and personalized monitoring of the patient. So if you think that you have a solutions, it's here. There is a QR code. So welcome. Welcome to the competition. And thank you for listening.
Thank you very much, Marion. Thank you very much.